If you are suffering from chronic pain, maybe you should give spinal cord stimulation a try. Today we are joined by Dr. Donald Greco with Active Life Physical and Pain Center. Dr. Greco, good to see you. How are you?
Good morning. How are you doing?
I'm doing great. Thank you so much for asking. So first of all, what is spinal cord stimulation?
So spinal cord stimulation is a therapy that's been around for over 30 years now for chronic, refractory, uncontrolled pain. FDA approved for chronic pain of the trunk and or limbs. I've been finding it a very highly effective, evidence-based, and it's a minimally invasive procedure to treat this pain that had not been able to be treated by any other means.
So how exactly does this work?
So basically what it is it's not unlike a labor epidural. So when a woman goes in to have a baby and they place epidural catheters in her spine, such as catheters like this into the spinal canal, instead of giving medicine in the spinal canal like local anesthetic, these catheters have electrodes on them. And that electrode is stimulated by a battery. And this is based off of pacemaker technology. And that energy is transmitted to those electrodes to block pain signals going from the trunk and or limbs to the brain. And that calms those overactive nerves down.
How effective is this? What kind of results are you seeing?
This new therapy came out with a high frequency stimulation, and these results were published about 4 years ago, showing 76% of the people that were implanted with this device were getting over 50% relief in pain or function. So that's a 50% improvement. In my practice, I've been finding the same results. I've implanted about 50 of these new devices over the last couple of years and getting the same type of results. It's really amazing treatment.
Well, how will someone know if spinal cord stimulation is right for them?
This treatment typically works for neuropathic or nerve pain the best. So if there's a mechanical problem that needs to be fixed still, we recommend doing that first. So sometimes we'll get our surgical colleagues involved. So there is a workup involved, but anybody who has pain in the back and or limbs, legs, arms, I highly recommend they come in to talk about it and see if they've been trying all the other things, medications, injections, physical therapy, surgery, chiropractic work, and we're still not making progress. That's what this treatment's for. It's for those people who just aren't improving. The first part of it that you would do is a trial where you just have a test period. It doesn't require any incisions or surgery, where we just place the catheters, again, with needles, and then we thread the catheters through the needles, take the needle out, and leave the catheter in place, and it's all taped up for about a week. After the week, patient comes back in, we just take the catheters out, there's no sutures to remove or anything, and we talk about it. If their pain was over 50% improved, then they would be a candidate for permanent implantation of the device.
And the big question everybody wants to know, is this covered by insurance or Medicare?
It is, isn't it great? I mean, that's how much evidence is behind this. And so, in a day and age when all these new novel cutting edge treatments are not being covered, we have something here in our arsenal that's super exciting and it's paid for. So yes, it is covered.
For more information, visit activelifepaincenter.com or call the number on your screen.